Thank you so much for inviting us on behalf of Heart and Stroke to be here today. On a personal note, I just want to say this is very meaningful to me and wonderful to be at this important event. I lived with my grandparents in my late teens and 20s, and during that time my grandfather was diagnosed with dementia, and my grandmother was one of the wonderful caregivers in our family who took care of him for 12 years before he moved on to a nursing home. And just recently, this past fall, she suffered a massive stroke herself at age 80. So it's very near and dear to my heart to be able to speak briefly about prevention of dementia and also how that links in with heart and stroke. So just want to talk then a little bit about what heart and brain health have to do with dementia. So heart disease and stroke are both vascular diseases, and they share several modifiable risk factors, as you've heard about a little bit today, with dementia, and in particular vascular dementia. So vascular dementia occurs in the brain when it's deprived of oxygen, and very similar to a stroke, when a stroke also deprives the brain of oxygen. And so it's the second leading cause, or it's the second main type of dementia, and accounts for about 20% of cases. And then when you look at individuals with Alzheimer's, about 80% of those people have vascular disease. So there's a lot of areas of overlap there. Where are things with heart and stroke? We've made a lot of progress in Canada. We've been able to save a lot of lives over the years, but still one person dies from a heart attack or stroke every 7 minutes in Canada. And it still makes up 2 of the 3 leading causes of death. Particularly for women, there's still 37,000 women in Canada dying from heart disease and stroke each year. And in PEI, that results, it's about, for both men and women, about 300 deaths from heart disease and about 80 strokes each year, resulting in death on the island. Now, when we want to talk about risk factors, we look at risk factors for heart and stroke, and 9 in 10 Canadians have at least one risk factor for heart disease and stroke. So today I just want to talk briefly about those shared risk factors and some of the tips and strategies for what you can do about them. The first thing I'm going to talk about today is hypertension. So hypertension is a leading risk factor for heart disease and stroke, and very common among those with diabetes as well. And it's also, we know, a cause of vascular disease, or vascular dementia, as well as Alzheimer's as well, that they're able to link it to. In Canada, it's about 1 in 5 individuals that have hypertension. On the island, for women in particular, it's about 21%. The scary thing about hypertension, though, is about 17% of those people don't know they have hypertension, and that's really what's concerning. When it's left untreated, it can cause a lot of issues, and we know that it increases women's chances of having stroke by 2.5 times, and it doubles the chance of heart disease as well. So it's really important to start to look at hypertension as a way to prevent dementia, stroke, and heart disease as well. So looking at that, what can you do about that? First thing is to know your numbers. So with hypertension, the main thing you could do is go to your doctor, get checked for your blood pressure. You can get a blood pressure monitor and check it at home on a regular basis as well, and start to know your numbers and track it. Heart and Stroke has a lot of great online tools and resources, so we do have an online blood pressure tracker that you can use to start monitoring it. And then from there, you'll know if it is too high, you can manage it with lifestyle changes and possibly medications. So to be considered low risk, you'd want it to be 120 over 80. So definitely start to know your numbers and then talk to your physician about what can be done about that. The next risk factor I just want to touch base on is physical activity, and I know we have some wonderful experts at the table who will talk in much more detail about that, but I'll just touch base again maybe with some stats for PEI. So on the island we do have higher rates of inactivity than other parts of Canada. So again, for women, we're about 50% of women that are inactive on the island of PEI. So again, some things you can do about it is looking to reach the guidelines. So 150 minutes of vigorous to moderate activity a week in bouts of 10 minutes or more. And really to do it, set small goals and work to it gradually, and find things that you can do in your day-to-day life. Walking is something, I think there's something on CBC this morning about walking groups. Heart and Stroke in Nova Scotia has a wonderful walking program, but it's something that you can do that is cost-effective, easy to do with friends or families. It can become social as well. I know my husband did a lot of studying at night, and so we actually went out and bought snow pants, and yes, they might be matching snow pants if you happen to run into us, but we like to go out sometimes, and that's why we go at night when it's dark, so no one can see us. But it was a really nice activity at the end of the night to build in, to spend some time together and to get out and be a little bit active during a time that was very hard to find time to be active. So find things that fit with your lifestyle and fit with your family and things like that as well. Consumption of fruits and vegetables. So again, it's about that 50% mark. More than half of Canadians do not consume the recommended amount of fruits and vegetables, which is 7 to 8 servings for women and 8 to 10 for men. And so again, that's linked to cardiovascular diseases as well as a higher consumption of fruits and vegetables can lower. It's been shown to possibly lower the chance of dementia, especially among women. So what can you do about that? One suggestion is to just double your veggies and recipes. You already have the cutting board out, chopping things, just double the amount that you're going to throw in. You can also grate them and puree them into your food if you're trying to sneak them in for people who may not like them quite as much. You can go out and look at those ready-to-go packages. Something I've even just started doing recently myself is grabbing the pre-cut vegetables, and sometimes when you price compare, it's not quite as bad as it might seem. And try a new fruit and vegetable when it's in season. So, look for something new that you haven't tried and make it something fun and enjoyable for yourself and for your family to try as well. And frozen's a good option as well. A lot of the freezing techniques have improved, and there's a lot of nutrients in the frozen fruits and vegetables as well. Obesity. So just want to touch base on obesity and having a healthy weight. So again, obesity is one of those things that affects many different systems in your body. As we know, it's linked to cardiovascular disease, diabetes. It also causes joint problems, and we know it affects mental health as well. It affects people's self-esteem. In PEI, 54% of our population is obese or overweight, and with women, it's 48%. So another huge concern that affects and impacts and links to many different disease conditions. Women with just even 30% more body weight than their healthy weight are increasing their risk of heart disease by 2 to 3 times. So what can we do about obesity? The first thing is to, understand and assess your weight. So your body mass index, BMI, the online calculators, you can look at that. Or even a quick way would be to measure your waist and waistline. So men should be under about 40 inches or women under 35 inches. Just a quick way, but get to know what category you fall in as well. And then looking at the lifestyle changes we've been talking about, so healthy eating and physical activity. Another thing as well is just drinking water, so avoiding sugary drinks. That can be a really quick thing that you can slowly change in your life depending on how much of a role that plays in your life. But just look at drinking water sometimes and going to water first instead of the sugary drinks first. And if stress is causing overeating, then encouraging individuals to look at the source of the stress first and trying to work on that as well. And again, online, there's another tool with Heart and Stroke. It's the our Healthy Weight Action Plan, and it just covers the basic principles of healthy weight, assessing the weight, and then different strategies that might work for your lifestyle. Diabetes is another risk factor, so type 2 diabetes, and that can double the chance of developing dementia when you have diabetes. In PEI, Islanders, we have a rate of 8% of individuals that have diabetes, but that rate is on the rise as well. And again, this can be prevented and delayed first with the right prevention techniques. So again, with diabetes, it's really talking to your physician and knowing your glucose numbers, your blood sugar levels, and working with your healthcare team to set goals on that and working on that healthy, active lifestyle again. Smoking. So smoking particularly really increases your risk for heart, stroke, and vascular dementia, as well as other types of cancer, as you know. It's one of those things we've made lots of progress over the years, which has been wonderful, but we still have rates of 17% of Islanders that are smoking. So it still is a major cause for concern and an area where we can make a lot of changes. So with regards to this, if something you want to look at, really talk to your physician and your other healthcare team providers and ask for help. There's other resources out there like the Smokers Helpline, which you can see online at smokershelpline.ca. And know that any point of quitting in your life will make a difference. Once you quit for 1 year, you decrease your risk by heart disease by half. So it's really something we want individuals to look at changing in their lifestyle. And the last risk factor I'll touch on is high cholesterol. So high cholesterol is a risk factor for hypertension and diabetes. We talked about how those play also as risk factors themselves. So LDL is your bad cholesterol. It builds up the fatty plaque on your artery walls, and HDL, being the good cholesterol, it helps to clear your arteries. In Canada, about 40% of people have high blood cholesterol. So again, it's very close to that 50% mark. So again, know your numbers, get your cholesterol checked and tested, see where it sits. Watch the fat intake in your diet. So for women, it would be about 45 to 75 grams a day. For men, about 60 to 105 grams a day. And when you do look at fats, choose healthy fats. So we're looking at nuts, things like the fats you get from nuts, olive oils, vegetable oils, and then limit the saturated fats that come from like red meat and your high-fat dairy products, and avoiding trans fats that you get in a lot of fast foods. And again, a diet high in fiber can also help reduce cholesterol as well. So just briefly, it's really, just want to mention this, all these different things as really a one-stop shop. You can see a lot of the risk factors I talked about today really prevent the other risk factors or conditions that we talked about as it relates to heart disease, stroke, dementia, and a lot of other diseases like renal disease and diabetes and cancer. So just we encourage everyone to go online, check out some of the heart and stroke resources as well. There's a risk assessment tool where you can go on and answer a number of questions and actually assess your risk of heart disease and stroke. And there's an app you can download, it's a 30-day app, and it just is like a 30-day challenge for healthier living. So just pick one or two things that you personally want to work on to live a healthier life. Start small and celebrate your successes along the way. There's extra materials at the back on the table there as well. Thank you.